Librela, Librela, the wonder drug for arthritis. The past few months, I've been hearing a lot more about it, and I've seen a few Facebook posts by some vet clinics that they're starting to promote it more. So there's a promotion push, and I'm just hearing more about it from people whose pets have used it. So I just want to talk a little bit about what it is and how I feel about it because I don't like it, to be frank. So what is the drug that's in Librela? What it is, it's an antibody against nerve growth factor. Okay, so you don't have to be a doctor to understand this. I'm gonna explain it. It's all right there in the words. So antibodies target something for destruction. Antibodies are what you have to diseases that come into the body. The antibodies are circulating around. They find it, they mark it, they attack it, and then the rest of the immune system destroys it to get rid of the threat. So we make these man-made antibodies against nerve growth factor, and that's what this drug is. So the idea is from big pharma and Western medicine, we're going to use this to kill the nerves that carry the pain signals away from arthritic joints. Um, well, it's not that simple because this thing's going to target any and all nerves, not just the ones coming from the arthritic joints. So a little bit more about what it does. Nerve growth factor in the name that helps nerves grow. It's a factor of some sort. It's something, some chemical messenger or hormone or something that helps nerves grow. Okay. Well, nerves are constantly needing to grow because they're constantly dying and constant wear and tear, just like skin cells and hair cells and everything else in your body. They're constantly dying and new ones are constantly replacing them, and there's constant turnover. So this drug's not necessarily destroying the nerves, but it's destroying the growth factor that tells the nerves to regrow and repair and replace the ones that have died. And nerves die quickly. So when you use this, the nerve function fades away really, really quickly. Um, and it, like I said, it affects any and all nerves, not just the ones coming from the arthritic joint. So there's a lot of bad stuff about this. People are seeing bad side effects, and there's a Facebook group about it where they talk about the bad side effects, not just what I'm getting ready to talk about, but other stuff. But I want to talk about kind of one main thing real quick that I think is the problem. And the problem is, as a veterinary community, Western medicine, whatever, the vast majority of veterinarians and pet owners like yourself, when you see a dog who's weak or older or stiff and sore, having trouble getting up, all the classic signs of what we call arthritis, well, we just assume it's arthritis. And my experience is that it's arthritis less than half the time. The majority of the time, what I'm finding is neurologic weakness. The nerves aren't working well, they're already weak. And that's why the animal is kind of stiff and sore and having trouble getting up because they're weak and their muscles are fading away because their nerves are weak to those muscles and they don't get used enough. So this can be for a number of reasons, whether it's something nutritional that your nerves aren't getting every nutrient they need to grow and repair properly, like nerve growth factor and lots of other things, or if the muscles and ligaments and tendons and connective tissue are all just super dehydrated and desiccated like a super old rubber band from the dry kibble and the lifestyle that we live in this country, or whatever, a chiropractic issue, an impingement. There's all sorts of things that can make the nerves weak. And just in my experience, in my practice, I see weak nerves as the problem way more than half the time, maybe more than three-quarters of the time, compared to true arthritis. Arthritis is bony degenerative changes and inflammation in a joint, which you can see on x-ray. And I think not all vets, I mean, a lot of vets are really good, but also a lot of vets, I think the majority, they see the weak old dog like you, they hear you say, oh, I think he's got arthritis, and they just assume it's arthritis too without checking the x-rays and checking for nerve function to see if the nerves are working properly in the leg with some neurologic tests and some rehab and physical therapy kind of tests. You can determine if there's an arthritic joint with bony changes or if the nerves are weak. You can determine that, but we don't take the time to do it very often. We just assume it's arthritis. Then the drug rep comes around and says, oh, we've got this amazing drug Librela that's great for all your arthritic dogs that nothing else is working for. So everybody's just doing it. Well, if you're the majority of those dogs who have weak nerves and you give this drug that stops nerves from growing and effectively kills the nerves, then you're worse off than you were to start with. And just like, elderly people, our grandparents or great grandparents, they're already weak with less muscle and not that great of nerve function and not that great of stability anyway. If we do something that kills their nerves, like they're bedridden for a week or so, just like this drug would do to you if it kills your nerves, you just don't recover from that at that age. Those older animals and older people, they don't have very much muscle left, and then they lose that. It atrophies really quickly if you're bedridden or you can't use your nerves for a few days or a week, and you don't ever bounce back from that. You can't rebuild the muscle and strength at that age. So I'm seeing a lot of that in person and on like the Facebook discussion group. So I strongly advise that you don't use the Librela. I don't like it because it targets any and every nerve in the body, not just the arthritic nerves, even if arthritis is the case, which it often isn't. So if you are going to use it, there's two things I think you need to be certain of before you use it. Number one, is it arthritis? You need x-rays or a really good physical exam that you know it's arthritis. And you need to do the neurologic exam and test the nerve function and test the muscle strength in the leg and make sure the nerves are working properly. Okay? If that's the case and you need to use it, well, then give it a try. And the other thing I recommend before you use it is, have you tried anything else? Chinese medicine, acupuncture, chiropractic, rehab, different herbs and supplements and nutritional changes that help nourish the nerves and muscles better. Because that's what I do, and it works most of the time. So there you have it. Thanks for listening.